Hi, I'm Dr. Michael Newman. I'm a board-certified plastic surgeon, and I'd like to share with you my recent experience using the Clear-Flo Nasal Airway system by Reltok. I used the system just recently for the first time about 3 weeks ago on a patient with a very severely deviated nose and deviated septum. Did a closed septorhinoplasty endonasal procedure on him. And traditionally, I would have used a Doyle splint on that patient, which is what I've used in the past and I've been very comfortable with. But I have realized that the airway on those tubes get clogged and really was looking for an alternative. And so I tried the ClearFlo device, and there are a couple highlights that I'd like to point out to you on my experience with it. One, it was actually much softer than I thought. Looking at the system, it looked very rigid and uncomfortable. But both the splints, the internal splints, and the nasal airway tubes were actually much softer than I expected, and thus more comfortable for the patient than I expected. So that made them easy to place and easy to tolerate. And then in addition, the airway actually was very functional, and so it was easy to suction through the tubing, easy to maintain an open airway, and easier for the patient to breathe. And so that really was a big advantage, and I think it made my patient more comfortable through the recovery. So a couple little highlights of that device that I thought were worth pointing out, and I think it's definitely worth a try for those of you doing nasal and septal surgery. Thank you.